Okay, now I'm going to show you how to set up your sterile field in preparation for a wound care type of a treatment. Now there are a variety of things that we would be using to include the possible sharps container, which we avoid handling very much, and that would definitely not be something that is sterile on the outside, so that is not going to go on our sterile field. When we create the sterile field, we're creating a safe area where there is sterile to sterile and nothing that is going to contaminate that would be involved. We have our sterile gloves, but those will not go on our sterile field because they have their wrapper of their own, so I'm going to set those aside. The medication that would be used for the patient, the container is never sterile, so that is going to be set aside as well. I might need at some point sterile water, but once these sterile containers are available, if I have sterile gloves on, I'm not going to be touching them, so those would also never go on my sterile field. These other objects, the tape is never sterile. So the tape, I can either have it handy or tear off strips in preparation for my treatment. And you can just stick those onto the side of the table. Sometimes they stick more, so it really doesn't matter because once you're using tape, you're not maintaining sterile hands anyway. Because by then the wound would be covered. So what I would use for dressing, I've got my sterile field, and anytime you use sterile objects, you inspect the borders. Make sure that the wrapper is intact so that we can ensure that the contents are indeed sterile. Then we will open the sterile wrapper very carefully because I don't want to touch or contaminate what's inside. I look at which side of the sterile towel I'm actually closest to, and I'm looking for an edge or a corner. And from here I can see a corner, and I can lift that up, drop the wrappers in the floor. I only handle the sterile field on its margins. It has long margins, one on each side, and I lay that out and do not touch. Do not go over, avoid going over, and avoid talking across your sterile field because you inherently will spray mist and spit over your sterile field, and that should cause an obvious problem. Then when I have my sterile items that I'll be using on the wound itself, I can carefully open those and then drop those on the sterile field, and then the wrappers need to go away somewhere. With the Q-tip, the long Q-tip, I can break it through the wrapper, careful not to break the stick. Then I can peel that back and drop that carefully in the center. And I might have to finesse it just a little bit. I take my bandages that I will wrap over the wound, and I can open those carefully and drop. Well, let me give you some bad examples of a bandage that if you drop it too high, it's gonna bounce. And mine didn't bounce so badly, but it got close to the border. If you drop something at the border, you generally want to leave it or drag it away, but don't risk touching anything. If your bandage wrappers graze and touch your sterile field at any time, your entire sterile field is compromised and it is useless, and you'd have to throw that away, which is fairly costly, as well as a time crunch for getting prepared for your patient's treatment. I have the medication that I would use. The medication inside is sterile, but this will never go on my sterile field. It goes alongside. Then once I don my sterile gloves, then I can dip in, but never double dip, and do not ever tap on the side. So this is how my sterile field is prepared, and I'm ready to treat my patient.